Tonight, some members of the Army Reserves are involved in tackling this rampant virus. It's a unique story with 4 of them doing it together.
They're in the emergency room at SLU Hospital, and that's where News 4's Alexis Zotos is tonight. Alexis.
Of course, COVID-19 is really at the forefront of what they're doing here at SLU Hospital. But we've got to remember, this is also one of the metro area's top level 1 trauma centers. So they see everything and anything. And we got a chance to be inside that ER to really get a firsthand look. And while we can't show you everything because of privacy laws, I can tell you what I saw is a lot of people working incredibly hard with only a limited amount of staff.
The uniform looks different these days, as medical professionals at St. Louis University Hospital's emergency department gear up for a battle against COVID-19.
We're going to take what's given to us and we're going to figure out how to make it work, and that's just what we do as ED nurses.
Sarah Moorhead is the team lead nurse. Her job, managing the staff and a massive influx of patients.
It creates a whole nother level of busy for us. It's because we're trying to manage all of those patients with just the respiratory illnesses, not just COVID, but flu, asthma, all of those other things that we're getting this time of year, but then also the sudden uptick of trauma. So it's kept our nurses very, very busy.
Moorhead is no stranger to stress. Her nursing career began 10 years ago, and then she decided to join the Army.
I was looking for something that would challenge me.
She was the commander of the 303rd Field Hospital, one of 4 Army reservists working right here in the emergency department of SLU Hospital.
We have this special bond because we've been through some things together and we've seen a lot together.
Captain Luke Leaves is the chaplain for the hospital.
We deal with sort of the highs and the lows of life, and unfortunately in a hospital like SLU, when you're working at a level 1 trauma center, there's a lot of pain, and there's a lot of loss, and there's a lot of death.
Even more so now.
The past few weeks really been going up a lot, and we're getting more and more COVID patients.
There are 43 rooms here in the emergency department at SLU, and every single one of them tonight is full. And there are patients that are sitting on beds like this in the hallway that are waiting for rooms.
We're maxed out all the time, so there's kind of a trickle-down effect where everybody's impacted, not just because we're seeing more people sick and more people dying, but just because of the volume.
But the death rate is not what it was in the spring, and Dr. Stephen Lorber, who was deployed to New Jersey at the height of the pandemic, says that's in part to the knowledge they've gained.
We've been able to incorporate some of that experience, and even though we have not faced those kinds of volumes or the morbidity, mortality that we were seeing in New York and New Jersey, it certainly helped guide us to keep our patients safe.
With no slowdown in sight, those working the front lines say don't let your guard down on the simple measures they know can help win the battle.
I think that it's easy to lose sight of, frankly, because we're all weary. And so, I have the benefit of being reminded every day when I come to work that this is still a thing, and frankly, it's getting worse, not better.
I asked these brave men and women, have the last 8 months been the hardest of their career? And they said the reality is they have seen a lot in both their careers in the Army as well as in their medical professions. And they say really every day is a new challenge. Someone walks through the doors here at the emergency department. Sam, Corey?
Very interesting to see that perspective that we always don't get to see. Alexis, thank you very much.